contracts are not very preferable, if they are not very attractive to the private sector, it's very questionable why the private sector would go into those contracts in the first place. And another thing regarding this is the lower accountability by the private sector. Yes, you can introduce different regulations, but it will always be the fact that the public sector will be more accountable to the citizens and to the country than the private sector, simply because the private sector wants to protect as much of their rights and their information as possible via confidentiality and other things than the public sector. And via those things, I believe, or the opposition can argue, that there will be some loopholes and other things that can be exploited. But of course, what the opposition on this current debate does right now is just pure rebuttal and providing some of the alternatives that can be made, because the France's system that has been introduced and this mechanism of national health insurance is it's very strong and it's pretty hard to rebuttal. And
so the opposition has rescinded the point that the French healthcare system is high performing and of great benefit to the populace in France, and that does offer quite a strong rebuttal for me, as some of the issues he mentioned is that these contracts and these overarching government regulation and subsidies could seem unattractive to businesses. And I would agree if there wasn't such great examples of this working in other states, much like France. The fact is that these contracts and this form of regulation and still subsidies allows for that economic benefit for the businesses, as well as government influence on how healthcare is delivered to the population. So there is a good mandate and good evidence that such propositions would be of great interest to companies, and they jump on it in many different nations. The opposition also did mention a little bit more about these previous examples being somewhat reflective of company greed and how companies have extorted the government and taken benefit from privatisation to the detriment of society. And that's how we're seeking to better this. What this discussion about regulation and subsidies is a proposition of how privatisation would be better done to serve the population in an area of industry like healthcare. It's one of the very areas where it makes sense to have some strong sense of overarching government in regulation, and that would limit companies' abilities to act in a malicious way, taking advantage of government. So it's very much expected that companies will gain profit, of course. I mean, they have to, but also that the population will benefit it. It very much goes back to the very principle of what democracy and liberal values are placed upon. I mean, one of the core values is the accumulation of capital, meritocracy. Those who perform the best and do the best deserve the very most. And if companies are doing good by the public, they should be rewarded and incentivized to do so. And that's what private economics purely incentivizes and is based upon. So it only makes sense for a democracy to operate over a private system of delivery of healthcare, yet still the inclusivity and availability that nationalised insurance does have. And another point, to divulge into another form of argument and benefit of privatisation is of course that for those who work within the healthcare system. There are wide inefficiencies, and ever since the splitting of trusts in a national model, we have seen these large expansions of bureaucracy, and privatisation will allow for it. Incentivise streamlining of bureaucracy, to then be better cost effective for the public and also offer greater benefit to those who are working as nurses, doctors, practitioners, whatever. It allows for a more streamlined management service and them to have more say and less overarching conflicts within management. I've heard multiple stories about how certain people in certain trusts have been largely affected by management and a bad culture within the NHS. There are certainly trusts around the UK that have bred hospitals with large controversies and horrible stories. And this is a way to streamline management and hopefully get rid of some of these individuals that have caused our health service to degrade. Of course, a nationalised health system also offers issues and conflicts in regard to accountability. If the government has large stake and influence in an area in such a dominant way in a nationalised industry in particular, there is this incentive against accountability and true scrutiny. If the government scrutinises the very healthcare service that they are responsible and own for the general public, there is this conflict of security. Whereas if it's a private company, you have this other incentive that this is what the government's meant to do, and it seems more just for a government to scrutinise a private company over their owned one. It offers a greater justification for scrutiny, and of course we do have committees that offer that scrutiny currently, but surely this will only be amplified and better serving within the executive if it's via a private company in which they are scrutinising. So there's many possibilities. I also wanted to touch on exactly how the French system that I'm discussing quite a lot in this debate has incentivised people to move into the healthcare sector. First of all, the French system, although they do pay slightly less than the European average, they have other perks. Of course, under the French system, they have national insurance for healthcare, and everyone pays a flat 15%, I believe. And what the UK national insurance would likely look like is a progressive tax instead. In the French system, those who are medical professionals have the benefit, if they appeal to certain quotas, to be able to opt out and have tax breaks in that specific area of funding, rewarding people who are working in the public interest. Such a policy would be highly attractive and beneficial in the UK and would be something that I'd advocate. That also lowers the tax burden for those who are performing great public service, yet still in a private area. So that offers extraordinary benefits to private healthcare workers. So we can expect greater benefit for those workers in regards to pay, and as well as their voice and opinion within a private institution.
Just a quick response to that, given the time that we are at right now. The proposition mentions two main points here. First is the bureaucracy of the nationalized healthcare system, and the second point on the benefits that we can give to the privatized healthcare workers. So on the first point, with the bureaucracy of the system, one can argue that with so many regulations that the proposition tries to put and explain to you today, it's hard to see how there will be less bureaucracy, because there is an overarch of what the prices should be, overarch on what is the quality of care should be, and with the national health insurance, one can argue that there will be no less bureaucracy in the privatized healthcare system that is put today. And on the second point, on the benefit to the healthcare workers, one can argue that, well, we can give the same benefits to the healthcare workers that we have right now in the national system. And this also actually leads to like my last point, is that as the opposition, after all the rebuttals that have been made, what you can say is that the alternative to the privatization that the proposition is arguing today are some of the improvement of the factors that were already mentioned, such as higher spending and preventive care, but also the improvements in the workforce development, such as the quality of the work environment that are given to the healthcare professionals, as well as other benefits that you can think of. And secondly, the improvement in the technology, research and development, for example, allowing the patients to see the doctors from home, better equipment for healthcare professional, and there are many examples that you can give and say that, well, if the French system on the table of the healthcare system is not extremely higher than the UK's, one can argue that just by putting the alternatives and improving the factors that were mentioned, we can go up to the level of France without going through a huge reform of the privatization. I think one of the arguments that the opposition should not say is that, well, if we now make this huge reform, this will be a huge mess, and how much money we're gonna waste. I mean, it's very intuitive, but I think in any debate one will argue that if there is a system that is better than the current one, we should always try to get to that kind of system, and that's the kind of argument that I would say the opposition should not try to make, even if you really want to. So just to wrap it up, for this particular debate, the main arguments that the opposition can argue is that the France's healthcare success comes from actually other factors than privatization. There is a high incentive for cherry picking in the privatized areas. There are examples of how the privatization has not worked in the UK, and that there are some alternatives that can be made to the privatized healthcare system that is proposed today.
So wrapping up, of course, the areas that the proposition can mention, I do really feel one of the strengths within the proposition and made it a very difficult topic to actually be opposition for is looking at those other healthcare systems and seeing why and where they perform so well, and looking at that and how that can be translated in a rational way within the UK system, as we are underperforming in comparison to these other nations. Of course, it is extraordinarily important for both politicians and people to criticise and examine those countries and systems that aren't like ours, and then see exactly where they do best and how we can evolve for the better of everyone. And that is the best kind of methodology to take when researching and thinking about this argument critically. Of course, there are some great arguments that the opposition can bring up in regards to the potential risks with profit, and the argument that, of course, private companies may do this at the cost of the population, and that is a concern. But looking at these other countries is a way to fight back against that idea, and also stating that privatisation doesn't mean no state involvement. No, the healthcare requires state involvement and these subsidies to incentivise private business. I also wanted to talk quickly about why this topic is so contentious and why year after year there is a blur of articles that are saying the Tories are trying to privatise the NHS and all this nonsense about the American system. It's awful seeing how British debate has turned into this "we don't want to be like America" rant, and that is what healthcare often is spoken about and treated like in the UK. The fact is that the American system has private insurance, which means that there is greater difficulty in regards to access of care, and as well as the very high quality of care that is offered within their private medical delivery part of their policy. If they had